Welcome to this video on emergency anesthesia procedures. Anesthesia is a field of medicine that allows us to perform medical and surgical procedures with minimal pain and discomfort to the patient, but sometimes emergency situations can happen that require special attention and planning. In emergency situations, the main goal of anesthesia is to ensure the patient's safety and to provide them with the best possible care. The anesthesiologist will first assess the patient's condition and determine the best type of anesthesia for the situation. Emergency anesthesia procedures may include general anesthesia, regional anesthesia, or a combination of both. General anesthesia is used for more invasive procedures and involves using anesthetic drugs to make the patient unconscious and unable to feel pain. The anesthesiologist will monitor the patient's vital signs during the procedure to ensure their safety. Regional anesthesia is used for procedures that require a specific area of the body to be numbed. Local anesthetic agents are injected into or around the nerves that provide sensation to the affected area. The anesthesiologist will also assess the patient's airway and breathing status to ensure that the patient can be safely intubated if necessary. If the patient cannot be intubated, other airway management techniques such as a laryngeal mask airway may be used. In addition to the types of anesthesia discussed earlier, there are other techniques that may be used in emergency situations. These techniques include sedation, which is the use of medications to reduce anxiety and pain, and hypnosis, which is a state of deep relaxation. It is also important for the anesthesiologist to be aware of the patient's medical history and any allergies they may have to certain medications. This information can be used to determine which anesthetic agents should be used and to minimize any potential risks associated with the procedure. In emergency situations, it is also important for the anesthesiologist to be able to recognize and respond quickly to any complications that may arise. These may include changes in the patient's vital signs such as heart rate, blood pressure, and breathing, as well as any signs of allergic reaction to the anesthetic drugs. In order to provide the best possible patient care, it is important for the anesthesiologist to remain up to date on the latest advances in emergency anesthesia techniques. This includes staying informed on the newest developments in anesthesia drugs, techniques, and technology. Conclusion: emergency anesthesia procedures can be complicated and require careful planning and expertise. The goal of anesthesia in emergency situations is to ensure the patient's safety and provide them with the best possible care. Thank you for watching this video on emergency anesthesia procedures.